So guys, my name is Dr. Wajid Khan. I'll be teaching you ophthalmology. So we'll be starting with this anatomy. We'll be starting with this topic of introduction of ophthalmology, in which we'll be covering the anatomy of the eye, and we will also cover something about the power of the eye. How do you go for calculating the power of the eye and all? Okay. So guys, starting with the anatomy of the eye. Ophthalmology is a very important topic, right? Not only in your university exams, it's important topic for the FMGE exam as well. Okay. So guys, starting with this topic called as anatomy of the eye. Anatomy of the eye. So when we are looking at the anatomy of the eye, you can see over here, guys. You can look over here. You can see this is the eye. This is the eye, and you can see here the eye diagram is being labeled. Okay. Now we will draw the diagram of the eye so that we can remember what is the actual structural anatomy of the eye. Right? While I am drawing, you guys should also draw with me so that you can easily remember. Right? So guys, so I'm just drawing the eyeball diagram. The first layer of the eye is called as cornea. The first layer of the eye is called as cornea. The next layer of the eye is called as, remember, the anterior outermost layer of the eye is cornea. The posterior outermost layer of the eye is called as sclera. It's called as sclera. The junction where the cornea and sclera meets, the junction where the cornea and sclera meets is called as limbus. That junction is called as limbus, right? We are discussing about the structural anatomy of the eye, and we are discussing the outermost layer. Anterior outermost layer is cornea, posterior outermost layer is sclera. The junction between the cornea, where the cornea meets with the sclera, that junction is called as limbus. Now coming to the second layer of the eye. The second layer of the eye. The second layer of the eye is called as choroid. It is called as what, guys? Choroid. This layer is called as choroid. Coming to the third layer of the eye. The third and the innermost layer of the eye is called as retina. It is called as retina. Right? Retina. Now this third and the innermost layer of the eye, right, from this, two bodies merge out. What are these two bodies which are merging out called as? These are called as ciliary bodies. These are called as ciliary body. And the junction where the retina meets with the ciliary body, you can see this junction, guys. The junction where the retina meets with the ciliary body. Right? Let me highlight you this junction. This junction I'm talking about. The junction where the retina meets with the ciliary body, that junction is called as ora serrata. That junction is called as ora serrata. Now, regarding the ciliary bodies, one part of the ciliary body will be pigmented, whereas the other part of the ciliary body is non-pigmented. The pigmented part of the ciliary body is called as pars plana, whereas the non-pigmented part of the ciliary body is called as pars plicata. The pigmented part is called as pars plana, whereas the non-pigmented part is called as pars plicata. Now there might be a bit confusion. Sir, plana means plain. No. Pars plana is a pigmented part. Even though the name is plana, but you have to remember that it's not a plain part of ciliary body. It's a pigmented part of the ciliary body. Okay? We'll come to the function of ciliary body later. We are discussing about the anatomy. We are discussing layer by layer. The anterior outermost layer was cornea. The posterior outermost layer was sclera. And the junction between the cornea and sclera was what, guys? Limbus. The second layer of the eye was choroid. And the third and the innermost layer of the eye is called as retina. That retina, from the retina, two muscles arises which are called as ciliary bodies. Okay? We have divided the ciliary bodies into two parts. One is the non-pigmented part, other is the pigmented part. The pigmented part is called as pars plana. The non-pigmented part is called as pars plicata. From the ciliary body arises a structure called as ciliary zonule. The function of ciliary zonule is to hold a transparent structure which is called as lens. The function of ciliary zonule is to hold a transparent structure in a position which is called as lens. So ciliary zonules hold the lens. Just in front of the lens, there will be a colorful structure which is called as iris. Now guys, I can say that this patient, imagine I'm drawing a patient's eye. I can say that this patient's eye color is green color. Why am I saying the patient's eye color is green color? Why? Because in the eye, what is the structure that determines the color of the eye? What is the structure that determines the color of the eye? It is the iris that determines the color of the eye. Hence, iris is also called as goddess of rainbow. Iris is also called as goddess of rainbow. Okay? Some patients will be having green eyes, some patients will be having black eyes, some patients will be having blue eyes. It doesn't mean that the whole eyeball is blue and all. It's basically the iris which is having a color that gives you that gives the differentiation between the colors and all. Okay. So anyways guys, we are talking about what? Iris. So just in front of the lens there is a structure called as iris. Right. So these are the structures guys. These are the structures. Now if we zoom into the picture, just look over here. If we zoom into the picture, you can see over here, right? There is a space between the cornea. This is cornea and iris. The space between the cornea and iris is called as anterior chamber. The space between cornea and iris is called as anterior chamber. Whereas the space between iris and lens, it is called as posterior chamber. It is called as posterior chamber. So in the eye, you are having anterior chamber and posterior chamber. What does anterior chamber means? It is a space between the cornea and iris. What does posterior chamber means? It is a space between iris and lens. If we divide the eye into two halves, one half will be called as anterior segment, other half will be called as posterior segment. Now guys, don't get confused. Okay? Anterior chamber is different, anterior segment is different. Anterior segment, if anyone is asking you what is anterior segment, you can basically tell anterior segment is equal to anterior chamber plus posterior chamber. Meaning what? Anything that is anything that is coming in front of the lens, it is called as anterior segment. यानी कि anterior segment में you will see anterior chamber, you will also see posterior chamber. So if we divide the eye into two segments, one segment will be anterior segment, other will be posterior segment. Anything in front of the lens is called as anterior segment, and anything that is behind the lens, it is called as posterior segment. This is posterior segment, right? So anyways guys, we are still dealing with the structural anatomy of the eye, right? Structural anatomy of the eye. Now guys, I told you the outermost layer of the eye is cornea, right? Anterior outermost. Posterior outermost layer is sclera. The second layer of the eye is choroid. In the choroid, you are having some special blood vessels that drain the choroid. In the choroid, you are having a special blood vessels which are draining it. What are those special blood vessels called as? Those blood vessels are called as vortex veins. These are called as vortex veins. So anyways guys, we are discussing about the anatomy of the eye, the second layer. The third layer is called as retina. Now, in the center of the retina, you see a structure. That structure name is called as macula. In this macula, you are having two light sensitive structures which are called as fovea centralis. Fovea centralis. Fovea centralis. Light sensitive structures are there in the center of the macula, that is called as fovea centralis. Okay? Then eye is supplied by a nerve called as optic nerve, and the beginning of the optic nerve you see a disc which is called as optic disc, right guys? So these are the layers that we need to remember. These are the layers of the eye. Okay? Anterior outermost is cornea, posterior outermost is sclera. The junction between cornea and sclera is called as, very important, which is called as limbus, which is the second layer of the eye, choroid. In the choroid, there are some special veins draining the choroid, which is called as vortex veins. The third and the innermost layer is the retina. The junction where the retina meets with the ciliary body is called as, again very important guys, that junction is called as ora serrata. Ora serrata. Ciliary body, I told you, they are divided into pars plana and pars plicata. The ciliary bodies, they give rise to ciliary zonule that holds the lens. Just in front of the lens, you see a structure. I have drawn a green color structure. It doesn't mean that the color of the iris is green. No, it can be green, it can be blue, it can be any color. Iris is the thing that gives color to the eye. Okay? So, just in front of the lens, you see an iris. If anyone asks you what is anterior chamber, you have to tell the space between cornea and iris is anterior chamber, whereas the posterior chamber is the space between iris and lens, that is posterior chamber. Okay? So anyways guys, this was regarding what? This was regarding a brief overview of introduction of the eyeball. Okay? Now guys, this was the brief introduction. This was a brief introduction of the structure of the eyes. Okay? Now guys, remember, eye is located in the orbit. The eyeball is located in the orbit. What is the volume of this orbit? This volume of the orbit is 30 ml. In that 30 ml, how much is the volume of the eyeball that occupies this orbit? The volume of the orbit, it can occupy 30 ml, but our eyeball is how much? Only 6 ml. From that 6 ml also, in the eyeball, 4 ml is of vitreous humor. 4 ml is of vitreous humor. So once again guys, we are discussing about what? We are discussing about the eye. Okay? The orbital volume is 30 ml, in which the eyeball occupies how much? 6 ml. From that 6 ml, 4 ml is of vitreous humor. 4 ml is of vitreous humor. Apart from that, what else we need to remember in the eye? Other thing that we need to remember is, remember I told you about the orbit. The orbit is having many walls. The superior wall, the inferior wall, the medial wall, the lateral wall. Okay? Now what we need to remember is, which is the thinnest wall in the orbit. The thinnest wall in the orbit is the medial or the nasal wall. The thinnest wall of the orbit is the thinnest wall of the orbit is the medial or nasal wall of the orbit. But the wall that usually develops a blowout fracture whenever there is a trauma to the orbit, whenever there is a trauma to the eye, the wall or the orbital wall which is easily damaged in the trauma, it is the inferior wall. Right? The wall more prone to develop blowout fracture, more prone to develop blowout fracture. What is that wall guys? Inferior wall. The orbital wall that is more prone to develop the blowout fracture is the inferior wall of the orbit. Okay, so anyways guys, this was regarding the orbit anatomy. Once we have finished the orbit anatomy, we have finished all the things guys. This diagram we have already discussed. I hope you guys have also drawn the diagram with me. So if you have drawn the diagram with me, you can easily remember the parts of the eye. Now guys, coming with, first we'll have a discussion on each part of the eye. Okay? Then we'll take down some notes for it. So guys, as I told you in the structural anatomy of the eye, I told you the outer anterior most layer is cornea. Starting with cornea guys, cornea, right? Cornea is the outer anterior most layer. There have been questions about the derivations of the cornea. Where is the cornea derived from? From which embryonic structure is the cornea derived from? Cornea is derived from surface ectoderm. It is derived from surface ectoderm. Is this cornea derived from surface ectoderm? No. The answer is not no. Answer is no. Remember guys, remember surface ectoderm gives rise to cornea, conjunctiva as well as lens. Okay? One of the derivation of surface ectoderm is cornea. Okay? So we are discussing about the cornea. It is derived from surface ectoderm. What is the function of the cornea, guys? What is the function of the cornea? Cornea acts as the most important thing for maintaining the refractive index. Maintaining the refractive index of the eye. Okay. Now guys, remember regarding cornea, what we need to remember? Cornea is a very important structure that helps in maintaining the refractive index of the eye. Apart from that, you can see cornea is curved as well as it is straight in some parts. Okay? When you look at this cornea, just look over here guys. We are talking about this layer called as cornea. Cornea is a bit curved and a bit straight in some parts. Okay? How will you know the curvature of the cornea? To know the exact curvature of the cornea, you have to go for an instrument called as keratometry. Right? So I told you, this cornea is straight and curved at some parts. So we can know the exact curvature of the cornea by a device or by a measurement called as keratometry. Okay. Now guys, remember, more important than curvature is the thickness of the cornea. Thickness of the cornea. Guys, remember, if the cornea is more thick or more thin, then it leads to some pathologies and some problems. But how will you come to know the thickness of the cornea, right? The thickness of the cornea can be measured by an instrument called as pachymetry. Pachymetry measures the thickness of the cornea. Keratometry measures the curvature of the cornea, right? Pachymetry measures the thickness of the cornea. Keratometry measures the curvature of the cornea. The normal corneal thickness is 500 to 600 microns. On an average, you will see it 540 microns. 540 microns. Right? Now guys, remember, there have been questions asking you about which is the thinnest part of the cornea. Thickness of the cornea can be measured by pachymetry, but which is the thinnest part of the cornea? The thinnest part of the cornea where it can rupture easily is the center part. What is that part, guys? The center part of the cornea is regarded as the thinnest part of the cornea, which it can easily rupture from the center, right? Now, refractive index of the cornea. The refractive index of the cornea is 1.376. That we'll discuss later. Those were the important points regarding cornea. So that was the anterior outermost layer, cornea. We need to know the derivation. It is derived from surface ectoderm, right? And I told you the curvature of the cornea is measured by keratometry. Thickness of the cornea is measured by pachymetry. And the thinnest part of the cornea is the middle part of the cornea. Now next guys, next layer of the eye is called as sclera. Now regarding sclera, what we need to remember? You need to remember two things. Where is sclera derived from and what is the thinnest part of the sclera? Sclera is derived from, any guesses guys, where is sclera derived from? Sclera is derived from mesoderm. The structures that are derived from, the ocular structures that are derived from mesoderm are what guys? Sclera is there, iris is there, choroid is there, extraocular muscles are there. We'll discuss that later, but just remember, sclera is derived from mesoderm. And regarding sclera, there one more question that could be asked is, which is the thinnest part of the sclera? The thinnest part of the sclera where it can easily rupture the most is what? Where it can easily rupture the most is what guys? What is that layer? Where the rectus muscle attached to the sclera, right? These are the rectus muscles attaching to the sclera. This layer or this part where the rectus muscle attached to the sclera, it is regarded as the thinnest part. It can easily rupture there. So remember, this is the two things that we have to remember about the sclera. So we have discussed about cornea, we have discussed about sclera. Second layer is what, guys? Second layer of the eye, choroid. Choroid. I told you guys, in choroid there are some special veins which are draining choroid. What are those veins called as? For the derivation of choroid. Choroid is derived from what, guys? Come on. Just now I told you, choroid is derived from what? Choroid is derived from, very good, mesoderm. Choroid is also derived from mesoderm. Sclera, iris, choroid and extraocular muscles all are derived from mesoderm. Whereas from surface ectoderm, cornea, conjunctiva and lens are derived. Okay. So next is what? After sclera and choroid, the third layer of the eye, which is called as retina. Retina is the innermost and the most important layer of the eyeball. Why it is the important layer? Why? Because once you put a light into the eye, where has the light to be focused? The light has to be focused on the center point of the retina. Then only your vision will be normal. Yes or no? Right? So remember, retina is the third and the innermost layer of the eye, which is the most important layer. Once again, first, for all layers, first we need to know the derivation. Where is retina derived from? Retina is derived from neural ectoderm. It is derived from what, guys? Neural ectoderm. Neural ectoderm. Right, guys? So remember, guys, the structures which are derived from surface ectoderm are, I used to remember CCL. CCL is derived from surface ectoderm. What is CCL? Conjunctiva, cornea, lens. Conjunctiva, cornea and lens are derived from surface ectoderm. Whereas from neural ectoderm, what are the layers derived from neural ectoderm? From neural ectoderm, it is retina, optic nerve, part of vitreous and intraocular muscles. Intraocular muscles. The derivation is very, very important, guys. From mesoderm, SIC is derived. SICE. What is S? Sclera, iris, choroid and extraocular muscles. Okay? Extraocular muscles. So these are the three things that we need to remember. The derivations of the structures we need to remember. Okay? So anyways, guys, we are talking about the retina. Retina is the innermost layer of the eye, which is the most important layer. We know the derivation of retina. In center of the retina, you see a structure which is called as macula. In the macula, you see a small light sensitive structures where maximum number of rods and cones are present. The most light sensitive area in the eye is the fovea centralis. You will see fovea centralis. The diameter of this fovea centralis is 1.5 mm. The diameter of fovea centralis is 1.5 mm. So anyways, guys, this is regarding what? This is regarding the retina. Next, after retina, what else we need to remember? The junction between the retina and the ciliary body we have already discussed, that is called as ora serrata. Then I told you that ciliary bodies are divided into two halves. What two halves? One half is called as pars plana, other is called as pars plicata. Okay? Pars plana is there and then is pars plicata. Pars plana helps in the formation of vitreous humor, whereas pars plicata helps in the formation of aqueous humor. Now guys, you must be wondering, what is aqueous humor and vitreous humor? That is the thing, that is the fluid component of the eye. The eye is having fluid component, yes or no? Aqueous and vitreous humor. Aqueous humor is formed by pars plicata, whereas pars plana forms the vitreous humor. The ciliary bodies give rise to ciliary zonules that holds this crystalline structure called as lens. Called as what, guys? Lens. right? Now we are talking about what? Lens. Now where is this lens derived from? Come on guys. We are talking about lens, no? We need to understand where is the lens derived from. You guys can easily tell the lens is derived from surface ectoderm. Very good. It is derived from surface ectoderm. What are the other structures derived from, other structures of the eye which are derived from surface ectoderm? CCL. Conjunctiva, cornea, lens. All are derived from surface ectoderm. So lens is also derived from surface ectoderm. Lens is also one of the most important structures in the eye that helps in maintaining the refractive index of the eye. Right? Now, in this lens, the lens is covered by all the sides by a thin layer or a thin blanket which is called as capsule. Okay? We'll discuss further about lens while discussing the lens in detail. In front of the lens is the structure which is called as iris. Come on guys, iris. Where is iris derived from? Iris means SICE. Iris is derived from SICE means iris is derived from mesoderm. The mnemonic for mesoderm derivation, the structures that are derived from mesoderm is SICE. Sclera, iris, choroid and E is extraocular muscles. What is the function of the iris? The function of the iris is it gives color to the eye. It is also called as what? Iris is also called as goddess of rainbow. Then I told you the eye is divided into anterior chamber and posterior chamber. Okay. Now guys, have you guys written this? The structural derivation and all. Now we'll take down a few notes. Okay. Starting with the cornea. Right. Now, starting with this thing which is called as refractive index. What is meant by the thing called as refractive index? Right? What is meant by the thing which is called as refractive index? Refractive index means what? How much of the cornea can bend the light rays is called as refractive index. There is different refractive index. In air, the refractive index is 1. I told you cornea is the most important medium for refractive index. In cornea, the refractive index is 1.376. Whereas in the lens, the refractive index is 1.38 to 1.40. What is the refractive index in aqueous and vitreous humor? It is 1.33 each. Aqueous is having a refractive index of 1.33 and vitreous humor is also having a refractive index of 1.33. Okay? Then I told you that in cornea there are some things that we need to remember, such as keratometry. What is keratometry used for, guys? Keratometry is used for measuring what? Keratometry measures the curvature of the cornea. Right? Corneal curvature is an important factor that determines the convergence of light rays. Okay? That's regarding what? That's regarding the cornea. Apart from that, what else we need to remember? What is the thinnest part of the cornea? You can just write there, guys. The thinnest part of the cornea where it can rupture the most. Thinnest parts are very important. The thinnest part of the cornea is the center part. Center is regarded as the thinnest part of cornea. Whereas, what is the thinnest part of the sclera? Thinnest part of sclera is the part where the rectus muscle get attached to it. The part where the rectus muscle gets attached to it. That is regarded as the thinnest part of the sclera. Okay. Next.